Hi, my name's Chris Capitura. I'm here with Dr. Sharief Ibrahim, and today we're going to answer the question, what is coronary heart disease? Now, Sharief, how do people know that they're having this happen to them?
That's really a very important question because I think the main concern about heart disease is because often present for the first time with a heart attack. And the heart attack could be complicated by cardiac arrest or sudden death. So I think this is the main concern about heart disease. The classical symptoms of heart disease is chest pain, which normally goes down the left arm. Why? Because the heart and the inner part of the left arm have got the same nerve supply. We said the pain goes down the left arm, but it can go to the neck, it can go to the chin, it can go to the upper part of the tummy. You see where the stomach is. So these are all symptoms of heart disease. The pain comes on effort. While at rest, there is no problem. But when they start exercising, going up the stairs or rushing or running or walking fast or doing any job, then they get the pain. But the pain usually settles down when they stop the effort. So it is effort related, which is relieved by rest. But also many patients present with non-specific symptoms. Fatigue, because the heart actually is the pump. So it distributes oxygen and nutrients and energy and fuel to the cells. So if the heart is not doing the job properly, then you feel tired, you feel fatigued because there is not enough of the things which you need to make energy. The other thing, also the heart supplies the brain with energy and other things. So if the brain hasn't got enough blood supply, then the person starts feeling dizzy or giddy, or sometimes they feel as if they want to faint. Also, the heart sends blood to the lung to be oxygenated, and this blood will come back to the heart and then be distributed to send oxygen to the rest of the body. But if the heart is not able to pump enough blood to the lung, then people start feeling shortness of breath on effort. Again, if the heart itself is not getting enough blood supply, it sometimes goes out of rhythm. It causes what is known as arrhythmia.
That explains the symptoms, how they present themselves. But let's get into the big question, the why. Why is this happening? What's the issues here,
I
actually?
think the main problem here is when the coronary artery is not really supplying adequate amount of blood to the heart, then the heart becomes symptomatic with pain and the rest of the other symptoms. So let us see why there is no enough blood supply to the heart. This is because of a condition known as atherosclerosis. And atherosclerosis means hardening of the arteries. And hardening of the arteries means buildup of cholesterol plaques along the arterial wall. And with narrowing of the artery, then we have reduced blood flow to the heart muscle. That is the problem, because there is a big discrepancy between the amount of blood is needed and what is actually supplied. And this is why the energy making become compromised and result in symptoms.
You're talking about symptoms here, and one of them in particular is chest pain. Now, it's not always the case that when you have chest pains that you're having a heart attack. Can you explain that?
Chest pain is not very specific to the heart. We can have chest pain with other conditions. And always when I see a patient with chest pain, we do the heart test. And the two tests we do in hospital is the ECG, the heart test, and the other one is a blood test called troponin. It's a chemical released by the heart when the heart muscle hasn't got enough blood supply. So when we do that and they report it back as normal, then we should really think about other possible causes of this pain. So the commonest cause is the musculoskeletal pain coming from the muscle and from the bones. We have got the big pectoral muscles, the rib and the central bone, the thorax. Usually this pain happens with movement and then relieved by stopping movement, and usually respond to pain killers like ibuprofen or something like that. The pain settles because it's pain coming from the muscle or the bone. A third type of pain is the pain which normally comes from esophageal pain, And this esophageal pain is always associated with heartburn and acid reflux.
I have to say, I know a thing or two about the reflux pain or the heartburn. For many years, it generally came down to the food I was eating. I made some healthier lifestyle choices and haven't really experienced it anymore. So let's go back for one point of clarification, Sharif. When we do get these chest pains in the heart, what's actually happening?
Why the pain happen? Because of discrepancy between the actual blood supply to the heart and the real demand. Because there is narrowing of the coronary artery, and so reduced blood supply to the heart, and so the demand is going to be more than the supply.
So, Sharif, who's at risk? Let's go through the different groups that may be at risk when it comes to heart disease.
As we know, heart disease is more common in old age. Heart disease is more in male. Females are protected from suffering heart disease because of the estrogen, because the female hormone, which protect ladies from having heart disease during the childbearing age. But once they go through the life changes, which is menopause, the risk of heart disease will be equal in males and females. Family history. The significant family history and smoking is a common risk factor for heart disease. Obesity. There are many causes for obesity, but I think the main reason for obesity is metabolic dysfunction. Heart disease is always common in people who eat poor diet, high in sugar and processed carbs, people who have a high level of stress, people who have inadequate sleep. These categories are always at high risk of developing heart disease.
Those are some great points, Sharif. And if you've been following us for a while, we've done a number of videos on some of those topics. So anything else to add before we wrap up this video, Sharif?
If you have already been diagnosed with heart disease, it's better to see your doctor to make sure that your heart disease is stable. We have given the battery of tests which would help in this respect, and you can discuss that with your doctor. If you haven't been diagnosed with heart disease and you have got high risk, it's also going to be very helpful to see your doctor, because your doctor will check you out and then you know exactly what is going on. I should reassure everybody that if you have heart disease or have high risk for heart disease, both groups are going to benefit from adopting a healthy lifestyle, include the diet of fruits and vegetables, beans, nuts and seeds, meat, fish, and chicken. Also, make sure you have a good level of physical activity, reduce your level of stress, make sure that you have a good, restful night sleep. And the last but not least, get involved in good, loving relationship.
As always, Sharif, thanks for all the great information. And thank you for everyone for watching this video. We look forward to seeing you on the next one. Take care. Sharief and I appreciate you liking this video, and more importantly, remember to subscribe to this channel. There's a lot of content that we're going to be creating, and we don't want you to miss a single second of it.